Hello, my name is Bolanle Adesanya, and I'm a student at the University of Texas Health Science Center here in Houston. I am taking the course called BMI 6313. It's all about scientific writing in healthcare. And I'll be presenting my paper, which is in partial fulfillment of that class. My paper is titled Binary Classification Model to Diagnose Diabetes Mellitus in an Intensive Care Unit. Last year, COVID-19 was a pandemic that really impacted intensive care units in the United States. Now, diabetes mellitus was identified as one of the diseases that could lead to mortality or other unfavorable health outcomes for patients with COVID-19. In a paper and subsequent study by Shi et al. In 2020, there was a conclusion using data contrasting patients with diabetes against those without diabetes, and they were able to confirm that indeed this is the case. Also, in a study conducted by Rahim et al. In 2020, it was concluded that a longer intensive care unit stay for patients led to a lower mortality rate for those with COVID-19. Now, this leads to the reason why this scientific paper was written, which is mainly due to being able to use what is called a binary classification model to diagnose that patients admitted into an intensive care unit within the last 24 hours have diabetes mellitus using the data gathered during that time period. Now, this data includes demographics, lab results, and vital results. So the objective of this study was to use that data from the last 24 hours to be able to detect or diagnose if a patient has diabetes mellitus, and then be able to say, hey, let this patient stay longer so as to reduce unfavorable outcomes for that patient. The data used was gathered by the Women in Data Science in conjunction with several healthcare specialists who had a big input into the exact features that were included to be able to get good results from the model generated. Standard data science process was applied to get the binary classification model and then eventually conclude on the final model. Code was written using Python. So Python is a programming language, and the Jupyter notebook that was used for the code will also be available as part of the paper. Now, the standard data science process that was used was first, of course, collecting the data, which were mainly Excel files, and then being able to manipulate those Excel files and put them in a format where the model could be able to train based on that. And then eventually, using several iterations of different models, eventually there was a final model decided upon that would be the one to be deployed and used in intensive care units in future. Now, the data that was provided by the Women in Data Science were of two forms. So there was a training data set, which was used to actually train the model. And this consisted of 181 variables, one of those variables being the actual label to classify yes or no as far as the diabetes mellitus diagnosis. 175 were numeric and 6 were categorical. Now, one thing about this data set was there was a lot of missing data, and we'll talk about how that was handled later on in the presentation. There was also test data included. And the reason for that test data is that after the training data set had been used to develop a model, and of course, even that training data set was split to have a test version as well to be able to fit the data appropriately. Then there was a test data also provided, which did not have that label of whether or not the patient had diabetes mellitus. So this test data set has the same features as the training data set and also has actually the same percentage of missing data. So it was very appropriate to be able to use it to test. And an open source tool was used to determine the best of 13 classification models. And out of all of those, the best was light gradient boosting model, which yielded an accuracy of 82.67%. Now, a few things that were noticed during the whole exploratory data analysis and being able to get to the final data model. For one, first of all, yeah, the encounter ID feature was unique, which confirmed that these records used were actually individual patient records. 81 features were eventually used to train the model. This was because a lot of the variables were missing data. Actually, roughly 60% were missing, maybe more than a quarter. And so it only made sense to remove those. The thought is that those features need to be included as part of some kind of standard operating procedure in the intensive care units to make sure they are actually collecting that data, because then they can be used in future versions of the model, the binary classification model. So in all, in conclusion, we were able to get this data into a form that was able to be able to use to train a classification model. And that classification model was also applied to the test data set of 10,234 patients. And this model is in a form that can be reused, and it can also even be improved upon as far as the model when more data is included in training to get more and more accurate and more better results. So in all, we're able to use this data set, get the model that can be used to determine if a patient has diabetes mellitus in an intensive care unit, and then they can be allowed to stay longer than 24 hours so that they can have favorable outcomes as far as whatever their condition is with COVID-19. Here are my references. And this concludes the presentation. Thank you.